We have heard the saying, a healthy skin is a reflection of overall well-being. Very good evening, viewers. Welcome to today's episode of BMC Global Live Al-HILAL Health World, an exclusive health talk. Myself, Marina Francis. Today's topic is something most of us would like to hear about. Something that at times may tend to pull back our self-confidence about our appearance. Our topic for today's episode is acne. We definitely have a very apt person today to talk to us about the topic. Joining with us in today's episode of Al-HILAL Health World is a specialist dermatologist and cosmetologist, Dr. Sithara Sreedharan. She has completed MBBS from Calicut Medical College, MD from Government Medical College Trivandrum, Senior Residency from Government TDMC Alapura, and is currently working at Al-HILAL Hospital, Muharraq branch. She is definitely a very apt person for us today with a 9 years experience in this field. So, moving on with the topic, let us hear more from her. Very good evening, doctor.
Hi, good evening.
We are very happy to have you with us in today's episode of Al-HILAL Health World.
Yeah.
So, doctor, let me begin with the very basic question to have a clarity for the viewers. What is acne?
Coming to the topic, acne is basically a condition involving the hair follicle unit. Our hair has hair follicles all over the body, from face up to the toes, up to the feet. Okay. So in certain areas, these hair follicle has a very active glands attached to it, called the sebaceous glands. And basically this acne is a condition involving this hair follicle and the glands. So why does this occur in certain particular areas specifically? That is because of the overactivity of these glands called the sebaceous glands in these peculiar areas like face, chest, back, arms, etc. So basically this is a condition involving the gland and the hair follicle in peculiar areas in our body.
Okay. So doctor, can we say that acne is a disease?
Yeah, good question. Because some consider it as a normal thing occurring with the process of aging or with the process of maturing. So they consider like it is a normal thing, doesn't need treatment like that. But that is not true, because acne, though 85% of the teenagers can experience this condition once in a while, this can have much impact on their social life, on their social outlook, on their self-confidence. Yes. So, it definitely is a disease that affects peculiar part of the skin, and it definitely needs treatment also.
Oh, okay, doctor. Let me just add on a question here that I felt to ask. Can we say that acne and pimples are one and the same?
Yes, yes. Acne is a medical term for a condition characterized by pimples. Okay. Pimples is the layman's term for the lesions occurring in the acne. Okay. And the acne is actually it has different kinds of lesions occurring, starting from the comedones, which we call the blackheads and whiteheads. From the blackheads and whiteheads extending to the big cystic or nodular swellings. From this comedones to the cyst, the manifestations of acne can vary. So usually I think the laymen refer to the term pimples to the small raised lesions, which is only one of the manifestations of acne.
Okay, doctor. So you told us about acne and it can be of different types. So we would like to know what are the causes of such a disease?
Yeah, acne, basically it can be called as influenced by genetic as well as hormonal factors. Okay. Why genetic? Because though 85% of the teenagers experience this, the severe form of acne occurs in a proportion of individuals. So that is because of their genetic predisposition. It is seen that due to some genetic factor, there is occlusion of the sebaceous duct of these individuals. I mentioned about the glands, right? Yes. So the duct of these glands remain occluded for some reason in peculiar individuals. So there is this sebaceous duct occlusion. Along with that, under the influence of the hormones, which become raised during the puberty time, during the teenage time. These hormones cause increased secretion of glands, increased secretion from the glands. So there is increased secretion with occlusion of the ducts leading to collection inside. And on top of that, there is infection by certain bacteria and fungi which are normally resident on the body, on the skin. So these bacteria gets inside this gland, causes infection and inflammation, and altogether this will trigger a reaction from side of our skin. Our skin will react to this. So all these together leads to outburst, what we call the outbreaks of acne. So actually it is like multifactorial, from genetic to hormonal to environmental factors.
Okay.
Apart from these basic things, many other external factors will contribute to it, like further occlusion of the skin pores by too oily applications on the face, certain greasy things that we use, or occupational exposure to petroleum or some other chemicals, then too much dust, exposure to dust and dirt. All these can cause further occlusion of the pores. So that can again lead to exacerbation. And apart from the normal variation in the hormone levels during puberty, there can be other causes which will lead on to hormonal fluctuations, like pregnancy or some diseases like PCOS, polycystic ovarian syndrome, or some ovarian tumors or such other conditions, or sometimes certain medications can cause some alterations in the hormonal factors. So different other factors also can add on to the basic genetic and hormonal milieu.
Okay. Doctor, so you were mentioning about the external factors that may cause acne. So can I ask you, like, we generally hear from our parents, do not eat much oily food, do not eat snacks and you won't be having pimples. The common saying. So let me ask you, is diet related to this disease?
Truly speaking, diet doesn't have such a big role in the incidence of acne. That is mainly because especially this oily food, doesn't have any role, we can say. Studies have shown that food with high glycemic index and dietary products, these two can have some influence in causing maybe this hormonal fluctuations, but not oily food in any manner. And even chocolates. Some parents also come up with, she takes a lot of chocolates or he is fond of chocolates. Maybe this is the reason. None of the studies have established the role of chocolates or oily food in the pathogenesis. But yeah, high glycemic food, that means food that increase sugar level very fast, like fast foods or frank sweets, this may have some influence.
Okay. Doctor, that answer would slightly make our teenage viewers happy. Anyway, doctor, let me ask you another question. Is there a difference between certain age categories getting this acne, or male, female? Is it more in female? Females, girls tend to be more conscious about it.
That is it. So, studies have shown that there is a slight female predisposition, but not much. A slight female predisposition is there, but acne tend to occur more severe in actually males.
Okay.
And regarding the age group, we have seen that about 80 to 85% of teenagers may be affected by acne, but in adult it comes about 1 to 3% only. But adults also do get acne. It is mainly the hormonal kind of acne because of some alterations in the hormonal milieu, because of some underlying medical conditions, or sometimes mere genetic factors also.
Okay. So doctor, let me ask you, is treatment needed for acne?
Yeah, as we have already stated, since this can have many impacts, like I'll tell you, as age progresses, the severity of acne definitely comes down after puberty, after the adolescence. Usually we see that the severity comes down and may wane off also, the acne lesions may wane off also. But if the person had very severe types of acne like the cystic or the nodular acne, definitely that will be leaving behind some sequelae, some after effects which may last even lifelong. The seculae may be sometimes just brown spots, sometimes it may be scars, pits, even uneven skin, and these seculae will last lifelong. And it's not very easily treatable or correctable also. So if we consider in that respect, it's always advisable to treat acne in the early stage itself so that it doesn't progress to the other severe grades and leave behind the seculae.
You said so treatment is advisable for acne, but then most of us are not aware of what are the treatment options available. So can you elaborate on the treatment options?
Yeah. Regarding the treatment option, it starts with the proper skin care at first. As I've already mentioned, the persons who are having that genetic predisposition, that is already having an oily skin, already having lesions like small comedones from the early ages, they have to be a little extra careful about the skin care. These oily and greasy preparations, topical application of these oily and greasy preparations on the skin will definitely lead to exacerbation or breakouts of new lesions. So they have to preferably avoid such oily things and switch on to maybe some water-based preparations like lotions or gels on their face. Like if you are going for moisturizers or sunscreens, pick the ones apt for the oily skin. Mainly the water-based ones. Then proper cleansing is very, very important. They have to use a mild non-irritant cleanser, but at the same time which can remove all the dirt and excessive oil from the excessive greasy things from the skin, which will declog the pores. So such specific cleansers may have to be used. Then the treatment proper depends upon the grades or the type of acne. I told from comedones up to cystic acne, different types are there. In the early stages of acne, just proper skin care with some topical creams, some applications may be enough, may be sufficient, like topical antibiotics or topical retinoids would be enough. But if the patient has inflammatory lesions like papules, pustules, where there is severe redness and bumps on the face, in that case topical applications may not be the only option. We have to go for something deeper, like oral medicines may be required. Maybe short course of oral antibiotics or oral anti-inflammatory drugs, but in severe cases maybe long-term medications are also advised. Some cases require medications anywhere from 3 to 6 months or even longer.
Okay.
So this is regarding the medical management. Along with the medical management, there are other adjuvant treatment options which we can combine with the routine medications, like chemical peels. Chemical peels are a kind of procedures that we do, that the doctors perform in their clinics for the patients, where they use specific medications specific medications on the skin, which will have special impact. And the peels that we use for different indications differs. For example, for acne, we have a different set of peels. For other indications like pigmentation, oily skin, anti-aging, dry skin, like that, we have other set of medications that we use. So usually for acne, beta hydroxy acids, that is salicylic acids and their precursors in various combinations can be used. It is a fat soluble kind of medicine which acts deep into the pores, help to declog it, cause a little bit of exfoliation, and thus help to reduce the severity of acne, help to bring down the inflammatory lesions, and also help to reduce the post-inflammatory pigmentation left behind by the acne.
Okay, doctor. So one common question that teenagers may feel is that should I visit a doctor when I face this issue, or when should we visit a doctor? What would you advise?
Yeah. So I told like about 80 to 85% will experience this problem. So all need not go for medical treatment as such. Maybe proper skin care would help in a majority of the population, in this majority of the group. But those who progress from the first stage to the second stage, that is from the comedonal acne, if they are progressing to papules or pustules, or the inflammatory lesions, definitely there is need for treatment. Otherwise, these inflammatory lesions will leave behind sequelae that may affect that person's self-confidence. That can have negative psychological impact on the patient's social life. So before it progresses to that stage, it is always advisable from the first stage to the second stage, it's better to go for medical treatment itself.
Okay. Doctor, when you were mentioning about skin cleansing or skin care, one common question that comes up is, can we use soap to cleanse our face?
Yeah.
It's a common question that gives multiple answers. So I would like you to answer.
It's a little tricky question because soaps, they are very strong and potent cleansers. So in very oily skin, it may not be a problem. It actually helps.
Okay.
But most of these patients may be on some sort of medications which may already cause some kind of irritation, dryness on their skin. Like some topical anti-inflammatory agents, some topical antibiotics may be causing some sort of irritation on the skin. And on this irritated skin, soap may have a negative impact. So in such cases, that's why I mentioned mild cleansers, but with specific characteristic to cleanse would be more beneficial than ordinary soap. Otherwise, a person having quite oily skin, the soap should not do much harm. But there is another set of patients who have basically dry skin with some seborrheic overactivity in some areas like the T-zone, like that. In that case also, soap is not good because in the other areas the soap will cause too much dryness and that can have its own problems associated. So that's why there are certain medical products which help to cleanse the skin without causing excessive dryness or irritation.
Thank you, doctor, for that answer. Now, something that leaves back even after the acne is gone is the acne scars.
Yeah.
And that sometimes irritates most people. So how do we manage acne scars?
Acne scar management needs a multifaceted approach, not just one procedure that will help in its improvement. And it depends, the outcome depends upon the duration of the scars, the type of the acne scars, and even the age of the person. If it is a quite old scar, like the patient used to get acne lesions during his teenage, that is 14-15 years, and now he's coming for treatment in his like mid-20s or early 30s, there has been already a gap of 15 to 20 years. These scars must have a kind of fibrosed and thickened. In that case, most of the procedure may not bring about a significant change, though change may occur, but significant change may not be there. So I would always advise the person to go for treatment in the beginning itself, within 1 to 2 years of the subsidence of acne, and once the acne has been controlled, it's better to start the treatment at the earliest. That is one thing. Then the type of scars, there may be small ice pick scars to big box scars, and different types of scars are there. So that also influences the outcome of the scar treatment. And as I told, different modalities are available and has to be combined for a good outcome.
Okay.
So the commonly used modalities are laser treatment, carbon dioxide laser, ablative, and some non-ablative lasers are also available. So these lasers are quite effective. Then dermabrasion, either with a manual dermabrader or mechanized derma pen. Dermabrasion will help. Then there are other options like radiofrequency needles, different other options. Even PRP, platelet rich plasma injection into the skin also will help in scar remodeling. So we need multiple sessions of multiple modalities to be combined in a proper way to bring about a good outcome.
Doctor, before we conclude today's episode, what would be one takeaway message that you would like to give the viewers? What would they have to remember after watching this talk show?
Yeah, acne being a common disease among teenagers, the teenagers should not hesitate to begin treatment from the beginning. That is one thing.
Yes.
And proper treatment is also very important. True. Because many of them go after these products they see on Instagram or other ads. True. And sometimes these have negative effect on the skin rather than a good outcome. Yes. Many a time they come with burns or other side effects. So before going behind such products, always do research and go after scientific treatment options, preferably from a qualified doctor itself. And along with the common medical treatments, now we have different other modalities also to be combined with the medical management, which will give a better and faster outcome in the form of chemical peels or lasers and other things, which will give a faster benefit, as well as we have different options for treatment of the sequelae of acne also, like the acne scars and pigmentation. So do not hesitate, come forward and get the best treatment from a qualified doctor.
Definitely, that would have been a very useful advice for all the teenagers and most of you out there. Hope this episode was a very useful one for you viewers. Thank you very much, Doctor, for spending your valuable time with us. Thank you for answering all our queries. So here we would like to come to the end of today's episode of Al-HILAL Health World. Until we meet in the next episode, this is Marina Francis signing off. Stay safe, stay healthy, take care of your skin. Good night.